Advanced chronic wound infection care and treatment. Renowned for his expertise in advanced chronic wound infection care, Dr. Bill Relaford's pioneering work is rooted in innovative strategies. He skillfully combines cutting-edge medical science with modern technology, resulting in unique, highly effective treatment plans. His focus on understanding chronic wound infections enables him to develop groundbreaking treatment techniques that are patient-centric and personalized. Continued research propels him forward in wound treatment advances, forwarding applications such as smart bandages, nanotech, and stem cell therapy applications. Exploring his findings offers deep insights into future possibilities for wound infection treatment. Key takeaways. Focusing on advanced strategies for treating chronic wound infections, Dr. Bill Relaford and the Wound Pros, WP, combine medical science with technology in his pioneering work. Customized treatment methods for wounds resistant to standard approaches have been developed by WP, which considers variables such as the severity of the wound and overall patient health. Emphasizing clear communication, patient autonomy, and collaboration within multidisciplinary teams is a distinctive aspect of WP's approach, which prioritizes the patient. Innovative techniques by WP involve a comprehensive viewpoint which integrates emotional and psychological aspects into wound care, aiming for improved patient outcomes. Proactive infection management and advanced technologies like smart bandages, tissue engineering, and predictive analytics will shape future wound infection treatments under WP leadership. Dr. Relaford's breakthrough in wound care. Pioneering work in wound care by Dr. Bill Relaford has changed the way chronic wound infections are handled, bringing fresh hope to patients across the globe. His research is centered around innovative strategies that greatly improve infection prevention, thereby lowering the likelihood of severe problems. His strategies combine cutting-edge medical science with sophisticated technology, utilizing an attentive, patient-focused approach that considers the distinct needs and medical conditions of every individual. This customized methodology guarantees optimal treatment, encourages quicker recovery, and minimizes the chance of subsequent infection. Research conducted by Relaford and WP has made significant progress in transforming wound care, traditionally a difficult field in medicine. By giving priority to infection prevention, his strategies don't just address the immediate issue, but also actively prevent potential future problems. His practice underscores the critical role of ongoing research and medical innovation. Understanding chronic wound infections. Persistent wound ailments are not ordinary injuries, but can be chronic with the added complexity of each patient's health issues requiring specific medical attention. Such conditions may endure due to an existing illness or complications in the healing process, often presenting resistance to conventional therapeutic approaches. Avoiding infection is critical in handling these prolonged wound complications. This requires meticulous wound management, involving the use of antiseptics and antibiotics, paired with a comprehensive understanding of the patient's overall health. The goal is to reduce or curb the risk of bacterial colonization and growth, which can exacerbate the situation and impede healing. Categorizing wounds is also essential in this type of wound care. This helps in identifying the most effective treatment strategies. Wounds are generally categorized based on their source, such as diabetic sores, venous sores, or pressure sores, and their healing stage. This classification system allows for a more focused and individualized treatment plan, thus enhancing the outlook and life quality for individuals dealing with these complications. Innovative treatment techniques implemented. The method adopted by Relaford stands as a progressive approach in managing persistent wounds, having achieved significant strides in the medical arena. This approach signifies a scientific advancement and validates its significance with remarkable therapeutic efficacy, thus it serves as a trustworthy option for persistent wound management. This groundbreaking method uses a wide-ranging viewpoint. It combines new treatments with tried-and-true traditional ways to come up with a complete treatment plan. Speed and success are the main traits of this new technique, as it quickens the healing of this type of wound infection, making patients' lives better. Many things can impact how well a treatment works, like how bad the wound is, the patient's overall health, and if they stick to the treatment plan. It's important to remember that while new methods like the one WP introduced show great results in managing stubborn wounds, we still need more research to make them even quicker and more successful. Patient-centered approach to care. Treatment of persistent wound infections has evolved to prioritize a patient-focused strategy, emphasizing the importance of catering to individual needs and desires. Personalized healing, as this approach is known, is not a uniform method. It formulates care plans based on the unique circumstances, medical history, lifestyle, and personal preferences of each patient. This strategy also includes holistic methods, which concentrate on more than just the physical wound. Psychological, social, and emotional aspects that could impact the healing process are also taken into account. A multidisciplinary team often collaborates to ensure better patient results using these methods. Believing in patients as active participants in their care forms the basis of this approach, not merely passive recipients. Their involvement and feedback are essential for successful treatment results. Clear communication, shared decision-making, and respect for patient autonomy are also emphasized, making patients feel valued and listened to. The future of wound infection treatment. Advancements in wound infection treatment are moving progressively towards fresh solutions with potential to revolutionize chronic wound care. Technologies of the future are expected to transform infection prevention, crucial in wound care, by focusing on early detection and proactive infection management. Frontline research is expanding our understanding and abilities in wound care, centered around the creation of advanced materials and methods. Smart bandages that can detect infections and provide focused treatment, the use of nanotechnology for accurate drug delivery, biological methods such as tissue engineering, and stem cell therapy are part of these developments. Digital health technologies are also utilized for remote wound monitoring management, enabling patients to actively participate in their care and making it possible for health providers to respond quickly when infection signs appear. Exploration is underway in the field to utilize predictive analytics and artificial intelligence in identifying patients at risk of developing chronic wounds, allowing for personalized prevention strategies. Frequently asked questions. What to do for chronic wounds? When dealing with chronic wounds, it is important that a comprehensive approach is taken. This includes wound assessment, proper cleaning and dressing, and monitoring for signs of infection. A healthcare provider should be consulted to determine the best course of treatment. In some cases, adjunctive therapy such as hyperbaric oxygen therapy or negative pressure wound therapy may be utilized. It's also important to manage any underlying conditions that could be contributing to the chronicity of the wound, such as diabetes or vascular disease. What is the most effective solution used to clean a chronic wound? Normal saline solution is widely considered the most effective and safest solution for cleaning most chronic wounds. It is gentle on the tissues, and it can effectively cleanse the wound without disrupting the healing process. However, the type of solution used may depend on the specific wound and underlying conditions. For instance, an antiseptic solution may be used for heavily contaminated wounds or wounds at high risk of infection. How often should a chronic wound be cleaned? The frequency of cleaning a chronic wound depends on the nature and severity of the wound, as well as the type of dressing used. Generally, chronic wounds should be cleaned each time the dressing is changed. This might be once a day or more or less often, depending on the wound's condition and the healthcare provider's recommendations. It's critical to keep the wound clean to promote healing and prevent infection. What is the best dressing for a chronic wound? The ideal dressing for a chronic wound depends on the specific wound characteristics. Moist wound dressings, such as hydrocolloids, alginates, and foams, are often used as they create a moist wound environment that promotes healing and the formation of granulation tissue. However, the type, size, and location of the wound, as well as the presence of infection or necrotic tissue, will dictate the best dressing choice. What is the fastest way to heal a chronic wound? The fastest way to heal a chronic wound is to address and manage any underlying conditions contributing to the wound's chronicity, such as poor circulation or diabetes. In addition, following a consistent wound care regimen including cleaning and dressing the wound, monitoring for infection, and maintaining a healthy lifestyle can also help to accelerate wound healing. Can a chronic wound ever heal? Yes, a chronic wound can indeed heal. However, because these wounds have failed to progress through the normal stages of healing, they often require more intensive and prolonged treatment. With appropriate wound care management and treatment of underlying conditions, most chronic wounds can eventually heal. What ointment heals wounds faster? There are several ointments on the market that can aid in wound healing. One commonly used is Neosporin, a triple antibiotic ointment that can help prevent infection. Additionally, ointments that contain ingredients like silver or honey have antimicrobial properties that can promote healing. It's important to remember that the efficacy of an ointment can depend on the type of wound and its specific needs. What deficiency causes slow wound healing? Several nutritional deficiencies can hinder wound healing. For instance, a deficiency in vitamin C can slow down the production of collagen, a vital component in wound healing. Zinc deficiency can also slow wound healing as this mineral is essential for cell proliferation and immune function. Additionally, protein energy malnutrition can dramatically slow the wound healing process. Is Neosporin good for chronic wounds? Neosporin can be used for chronic wounds to help prevent bacterial infections. However, it's not typically used as the primary treatment strategy for these types of wounds. Chronic wounds often require more comprehensive treatment approaches, including regular cleaning, appropriate dressing, and management of underlying conditions. What are the 3 treatments for a chronic wound? First, debridement, which is the removal of dead or infected tissue, is often necessary for chronic wounds. Second, advanced wound dressings that maintain a moist wound environment can promote healing. Third, adjunctive therapies such as hyperbaric oxygen therapy, negative pressure wound therapy, or growth factor therapy can be used to stimulate wound healing. In all cases, managing underlying conditions such as diabetes or vascular disease is crucial. What are the three main types of chronic wounds? The 3 main types of chronic wounds are venous ulcers, arterial ulcers, and pressure ulcers. Venous ulcers occur due to improper functioning of venous valves, usually in the legs. Arterial ulcers are caused by poor blood flow to an area, often the feet, leading to tissue damage. Pressure ulcers, also known as bed sores, occur when constant pressure on an area of skin causes loss of blood flow and subsequent tissue necrosis. How long does it take for a chronic wound to heal? The length of time it takes for a chronic wound to heal can vary greatly and is dependent on the size, depth, and location of the wound, as well as the person's overall health and presence of underlying conditions. For some, healing can occur in a matter of weeks or months, while others may find their wounds persist for a year or more. Even with optimal treatment, some chronic wounds may never fully